You know all about tension headaches, cluster headaches, and eye strain headaches, more than you'd like to about sinus headaches, caffeine withdrawal headaches, and migraine headaches. You've probably lived through your fair share of hangover headaches. Around 45 million Americans regularly suffer from headaches, and while most are the common afflictions above, a much smaller group of people deal with rare, more unusual types. There are hundreds of types of headaches as categorized by the International Headache Classification. To tell them apart, doctors typically need patients to provide a detailed history of what their symptoms feel like, as well as when and how often they occur. Each type of headache has a distinct history, and that history determines what types of tests will be used to confirm a diagnosis. The more a person can think about the features of their headache, the more effective an evaluation is going to be. Here are some of those lesser-known types you should be aware of. Exertion headaches. These headaches occur in the minutes following some kind of physical exertion, including exercise, sex, sneezing, laughing, or even, pooping. When you bear down, as you do during many of these activities, the spinal fluid pressure in the head increases briefly. That pressure leads to pain, which, luckily, is usually no cause for concern and should pass within a few minutes. In rare cases, there could be a blood vessel problem causing this pain, so if a headache comes on extraordinarily strong soon after exerting yourself, go see a doc. Hypertension headaches. Just like the name suggests, this type of head pain has to do with your blood pressure, but average BP isn't the culprit. Instead, this headache is caused by really high blood pressure, in the range of 200/110 or higher. When blood pressure is very high, it's elevated in the brain as well. Blood vessels may be restricting blood flow to the brain. A hypertension headache can feel like that very specific pain you might get from wearing a headband, and it's generally worse in the morning and improves throughout the course of the day. According to the National Headache Foundation, to alleviate the pain, it's crucial to keep BP under control. Giant cell arteritis. The cause of this boring, burning, or jabbing head pain remains unknown, but the condition is extremely serious. We do know it's linked to inflammation and almost always seen in people over the age of 60, who often also feel pain around their ears when chewing with these types of headaches. About 1/3 of people with giant cell arteritis will go blind, so it's typically considered an emergency diagnosis. Doctors will start treatment with steroids as soon as possible to prevent blindness and dramatically improve the pain. Trigeminal neuralgia. The older you get, the more likely you are to have this pain in the temples and around the jaw. Very sharp pain, like an electric shock, is typically triggered by something like touching the face or brushing the teeth, and people with this condition may experience several shocks a day, possibly due to an artery pressing on a nerve. Muscle relaxants might help, according to the National Headache Foundation, but if a patient with these symptoms is younger than 55 or so, it may also be caused by a neurological disease, like MS. If you liked the video, give it a thumbs up and share it with your friends. If you want more recipes and tips, subscribe to the channel.